Hey, what is diabetic foot ulcer? There are certain questions that need to be answered. What is a foot ulcer? What are the symptoms? What tests are needed? How are the foot ulcer treated? How do I care for myself at home? What follow-up care do I need? How can I prevent getting foot ulcers? When should I call the doctor? So, the answers are the diabetic foot ulcer is an open wound or sore on the foot. And people with diabetes have a high risk of foot ulcers. People with diabetes can have problem if their blood sugar is not well managed. These include nerve damage, which is also called diabetic neuropathy, damage to the blood vessels, which is called peripheral arterial disease. Now, these things can increase the risk of foot ulcer. For this reason, people with diabetes need to take special care of their feet. If you think that you might have foot ulcer, tell your doctor and get treatment right away. The earlier you get the treatment, the less likely you will get an infection or other complications. Now, what are the symptoms of foot ulcer? The symptoms might include irritated skin. The skin might look red, painful, and bleeding from the area. A bad smell from the area, swelling, and skin that looks dead or discolored. Pus draining from the area. Will I need tests? Yes, if you have changes in your feet, your doctor will do an exam and ask about symptoms. If you have signs of poor circulation, you might also need tests. Your doctor might do a lab test called a culture if they think your ulcer might be infected. How are the foot ulcers treated? Treatment depends on how severe the ulcer is, whether it is infected, and your other symptoms. Some ulcers just involve the surface of the skin and can be treated at the doctor's office and at home. If the ulcer is deep or if there are signs of infection, you must stay in the hospital while your ulcer is treated. The treatment includes cleaning and bandaging the ulcer. Removing a small amount of affected skin on your foot is called debridement. It might be done at the doctor's office or in the operating room. Taking antibiotic medicine. These are used to treat infected ulcers. Mechanical offloading. This means using a device to help you move around without putting pressure on your ulcer. Revascularization surgery. This tries to improve circulation to your foot. If the ulcer doesn't heal with treatment, or if you have a severe infection that is putting your health at risk, part or all of your foot might need to be amputated. This means removing it with surgery. How do I care for myself at home? Ask the doctor and ask what you should do when you go to home. Make sure that you understand exactly what you need to do care for yourself. Ask questions if there's anything you don't understand. While recovering at home, you should take all of your medicines as instructed. Change your bandage as instructed by your doctor or nurse. Use any device the doctor gave you to help you move around. This might be a special cast walker or modified shoes. Follow your doctor's or nurse instruction about showering or bathing. What follow-up care do I need? The doctor will want to see you again after your ulcer is treated to check on your progress. Go to these appointments. How can I prevent getting foot ulcers? One of the most important things you can do to lower your risk of the foot ulcer is to keep your blood sugar under control. See your doctor regularly and have them check your feet. You should also take care of your feet. Check your feet every day for any problem like cuts, blisters, or swellings. Keep your feet clean, but do not soak them. Trim your toenails straight across. Protect your feet. Wear shoes and socks all of the time, even at home. Make sure that your shoes fit well and are not too tight or too loose. Do not let your feet get very hot or cold. Avoid smoking. If you smoke, try to quit. When should I call the doctor? Call your doctor or nurse if you have a foot ulcer and signs of infection such as fever of 100.4 Fahrenheit or higher, or chills, swelling, redness, warmth, a lot of pain when touched, discharge, pus, or a bad smell coming from the ulcer opening up or not healing. You have new broken skin, blisters, cuts, or sores on your feet. Your feet or legs are numb. You have black or deep tissue in your ulcer. You have any changes in the shape of your toes or bottoms of your feet. Thanks.